Cervical cancer is a preventable disease. The primary prevention is through vaccination to prevent advancement of disease. However, some women have been exposed to HPV. There's currently no vaccination for human papillomavirus in Mozambique. Hence, a lot of women present with lesions that can be treated to prevent disease in the long term. The providers, or very few providers, have been trained to develop those procedures, and the colposcopy and LEAP training course is allowing us to train a lot of the doctors and residents to do these procedures at the community centers for these patients before they develop cervical cancer.
I'm a nurse practitioner from MD Anderson Cancer Center in Houston. I was invited to come on this trip to help teach a LEAP and colposcopy course to the physicians in Mozambique. It's been a wonderful experience. Many doctors came to the course, I believe about 35 or 36. We had lectures, and then I was part of teaching how to use a colposcope, how to do a biopsy of a cervix, how to identify abnormal lesions, and I got to work in the clinic with many patients, with the residents and fellows, and it has been a wonderful experience. They're very open to suggestions and very willing to learn. The patients and everybody here have been extremely gracious, and we're hoping that through our efforts that we can reduce cervical cancer burden in Mozambique.
For those trainings, we have partnered with Rice University, the bioengineering department at Rice University, where students are developing high-fidelity cervical cancer models that allow us to train the providers in a very similar way than they would do when they're seeing patients. And we are currently assessing the fidelity of those models and doing a very thorough evaluation.
We have been growing our course. This week, we received doctors from other provinces, and we were super happy to see how excited they were. They could practice with models, and then they could see patients with us. So we are super happy to be here helping them to help the women in Mozambique and to reduce the cervical cancer.
We also partnered with the Ministry of Health in Mozambique to train providers not only in the main province, which is the Maputo province, but providers are coming from the distant regions as well for this 2-day colposcopy and LEAP training course.